Hello, very good afternoon to you, and welcome to another edition of the Young Voices Forum. First of all, I'd like to apologize for the delay. We had some few technical hitches, but our technical team has sorted out, and I'm hoping that we have a smooth transmission. So today, our topic of conversation is comprehensive abortion care. What is comprehensive abortion care? And in these times, we've realized that the number of cases involving unsafe abortion has been going up and up and up. What can we do as individuals? What can we do as organizations? What can the health ministry do today? That is what we are discussing today. And I have with me in the studio two amazing women to help me with the discussion. But before that, this program is brought to you by SAVSIGN TV, an initiative of Savana signatures, and it is in collaboration with the Ghana SRHR Alliance, and is supported by SIMAVI, SGS, and Abby's Beauty Parlor. So we are going to zoom into the conversation. If you have any questions, any comments, you can use our comment section. And if you are watching this video, you can share so that other people can also be able to watch it. Welcome.
Thank you.
How are you doing?
Not bad. We are fine.
Okay, so I will start with you, Madam Rosina. What is abortion?
Abortion simply means the termination of a product of conception before viability. Now, that is another probably technical term. And when we say viability, it means before 28 weeks. Okay. That's approximately 7 months. So if a pregnancy terminates or stops before 28 weeks, then we say that is an abortion.
Okay. Madam May, you want to add something?
Yes, please. To add up to Madam Rosina, abortion is the termination of pregnancy before the 28th week of the pregnancy. And sometimes when we say abortion, it can be either spontaneous or induced. So we have different types of abortion. We have the induced one and we have the spontaneous one. And when I say spontaneous, with that abortion, it happens, it's natural. Okay. It happens without any cause. Like you didn't induce it, you didn't go for it. But the induced one, you opt for it, either through medical or surgical procedure.
Okay. All right. So I think that there's been a raging debate. You know, people have a lot of debates when it comes to abortion. It's like it's a gray area. It's not so black and white for us. Do you think that women should have abortion?
Typically, there's no a typical abortion seeker. It could be me, it could be you. Yeah. So usually, as you said, rightly said, it's an area that people hesitate to talk about. Yeah. And so here we are portraying what the profession says about this, and not, of course, what I believe or what I don't believe. But then if you ask me whether a woman can seek abortion, yeah, I think professionally, yes. You should be able to seek abortion, and then depending on the reason, as I said, it could be anybody. It could be the 40-year-old woman who plan gets pregnant. She doesn't intend keeping it. It could be a young person of 15 years. So there are several reasons why women seek abortion services. And so if one does that, you should be able to get safe abortion services so that you live to probably, let's say, repent for sins in quote. So yes, I think so, professionally.
Okay, so we've mentioned safe abortion and we've mentioned unsafe abortion. So I would want Madam Rosina, you start with safe abortion for me, then Madam May will come in with a safe abortion.
Great. Now, when you are talking about abortion, there are several things you need to look out for. So, for example, a lot of young people or people seeking abortion usually make certain mistakes before they get to us, and all these things are important. So when we talk about safe, in Ghana, we are looking at the comprehensive abortion care, which is called CAC for short, CAC, CAC. Now, comprehensive abortion services is not just terminating a pregnancy, it goes beyond that. And so when a young person or whoever is seeking abortion comes in, first of all, a counseling procedure is done. Now, during the counseling procedure, you are counseled on various steps. One of them is keeping the pregnancy. You could keep the pregnancy, deliver, and then probably give the baby out for adoption, because there are couples that are seeking for children. And so you could give a child out. We also look at sometimes counseling to bring in support persons. It could be the parents, it could be relatives, so that when the young person or whoever delivers, this baby can be taken charge of by somebody else, whilst the next person takes, for example, if it's a young person seeking education, the person can continue and later on comes back to support, so the child is there. Now, if these two fails, then we move into the next one, which is counseling to terminate a pregnancy, which takes several steps. First of all, you need to make sure that professionally the pregnancy is, or the product of conception is in the womb. And then we counsel through the various methods to safely terminate. We have two methods, which is one of them is medication, then the other one is surgical.
Okay, I'm going to put a pin in on that. I will let Madam May come in with the unsafe abortion, then we can talk about the methods of termination.
Great.
Okay.
With unsafe abortion, that one is terminating pregnancy in an illegal manner, or not following the various procedures in terminating pregnancy. Just as Madam Rosina said. Just as Madam Rosina said, we have various steps, and there are so many things you would go through before your pregnancy is terminated. That's if you opt for it. And they will first of all try to convince you to keep the pregnancy. But if you don't want it, you can go ahead to terminate it.
Is that right, to try to convince someone to keep a pregnancy?
Through the counseling, the person may change their mind.
Okay.
There are instances that someone does not know that she can give birth and give it out for adoption. And there are others who don't also know how to give their children out for adoption. And during the counseling, they will tell them all those things.
Can I come in?
Sure, you can.
So when it comes to these things, it's called counseling to make an informed choice. So the choice is supposed to, you decide to terminate because you're informed that that is the right thing to do. So that is very, very important. So nobody tries to force our will on whoever is seeking for termination. So we counsel you to make an informed choice. So the choice is actually yours at the end of the day.
Okay.
So if you don't go through those processes, you go ahead either through a quack doctor or a quack nurse or any other over-the-counter drug seller to get medications for termination, or you go to the local traditional birth attendants for any of the herbs to terminate the pregnancy. That's an unsafe method of aborting the pregnancy.
Okay, so we are talking about the methods of abortion, you were saying.
Great. So the methods of abortion, we have two methods. One of them is the medication, which we give you some form of drug to take and give you the regimen. There's a particular and correct way of doing it. And then the second one is a surgical abortion. We call it MVA, manual vacuum aspiration, which is done, where we go into the uterus and then try to bring out the product of conception.
Okay. So when people come to seek for a safe abortion service, do they do you tell them that these are the various methods, or you just look at how long the pregnancy has been there and then you decide to perform whichever method you deem fit, or they get to choose?
Yes, they get to choose. You get to choose which method you feel, because definitely will take you to how you feel when, what to expect when you are given the medication, and then the surgical one too, you are told what to do. So your choice depends on what you want.
Okay, so it doesn't depend on how long the pregnancy.
No.
Okay. So
both methods can be applied irrespective of the gestational age or how old the pregnancy is.
Okay, so at how many months can a person get a safe abortion?
Great. It depends on the type of professional you are dealing with.
Okay.
So for me as a midwife, and my colleague midwives, we are allowed by law to only terminate after 12 weeks gestation. So that's approximately 3 months.
Okay.
Beyond that, a midwife will not be able to help you. But then there are medical or what we call obstetrician gynecologists. They can handle up to a particular point, which I won't be able to say, but then they can handle pregnancies beyond beyond the 3 months or 12 weeks I spoke about. But then to make it safer, it's better because usually as it passes 3 months or 12 weeks, a lot of people hesitate to help.
Okay.
Yes.
Okay. So as you work with the young people, I that's what I want to assume, that you work with young people. How often do you receive young girls asking for this service?
Almost every day, people walk in with various stages of needing help. Every day that's not pass. And of course, if you come to my facility, I'm not the only midwife there. But then if you look at the records, there is no day that passes without a young person seeking for.
Madam Mary, how often do young people come for?
They do come very often.
Okay.
Though it's the health center, outside is a health center. But I would say within a month, if they don't get at all, at least they should be able to get 5 people.
Okay.
And others have also been referred to other facilities.
Okay. So you talked about unsafe abortion. So I would want to start with you. What are some of the complications of unsafe abortion?
Unsafe abortion has so many complications, amongst which include infertility.
Okay.
Sometimes during the procedure or in the process of terminating it in an illegal way, it may lead to long-term barrenness.
Okay.
And also, another complication of unsafe abortion is uterine scarring. With that one, you get some scar in your womb, making it difficult for the next conception or the next pregnancy you get to be able to stay longer. And also, another cause or another complication of unsafe abortion can also be a miscarriage. Sometimes the baby would be there, but heartbeat will not be there, and the pregnancy will not be able to come to term. So you have to go for this thing, physical removal, or you can wait for it to come out by itself.
Okay. So if you just joined us, this is the Young Voices Forum, and we are discussing comprehensive abortion care. So I have some comments from people who are watching us live, and I would want us to look at some of the questions they are asking. So MFA Eto is asking, are our health facilities mandated to provide comprehensive abortion care?
Yes. A serious resounding yes. The reason is that the comprehensive abortion services is backed by certain guidelines and protocols. One of them is the Ghana Health Service guidelines and protocols that is providing comprehensive abortion services at almost all, I'm saying almost all government facilities. They have corners or places designated for this kind of service. Yes, it is supposed to be provided. Now let me add something. And as a midwife professionally, there's something we call consensuous objection. When I am dealing with a young person below the age of 18, I cannot refuse to give service as a midwife who have been trained with the Ghana government's money. I cannot object to give service to a young person. I may not probably do the termination myself, but then I am mandated by law to counsel such a young person, give the young person options that are available, and now refer the young person to somebody who can be able to do the termination for the young person.
Okay.
That is what a lot of people are not aware of.
Okay.
Yes.
Wow.
Mandatory.
Wow.
Yeah.
Wow. That's very insightful. So Bella says this is very educative. Thank you very much, Bella. And someone is also asking, the person is saying, I would like to know how accessible the services are, taking into consideration cost service delivery, which implies qualified health workers. How accessible is abortion? Madam May, that's that from you.
Abortion of late is accessible in almost all facilities which are registered under the Ghana Health Service or Ministry of Health.
You are sure?
I'm very sure.
Okay. Because feedback we keep getting from a lot of other people suggest otherwise. But okay,
No.
It's very accessible.
It's accessible in all the hospitals.
Oh, okay.
Which have midwives. Because not all, in most of them, because it's the midwives who are allowed to do those things. So if you come to the chicken compounds, usually some of them don't have midwives, and other health facilities or health centers don't have midwives. So when you come to them, they will only refer you to the appropriate personnel. So any hospital which has a midwife, you can go there for a comprehensive abortion care.
Okay,
and
so,
it's allowed.
Oh, okay. So Bella is also asking, is abortion legal in this country? So let's get into the legalities.
All right. So abortion is illegal. Please, you listen to this very well because it has a lot of twists and turns. Now, when it comes to abortion under the law, it's illegal. That's the PNDC Law 102 of 1985. It says, and I paraphrase, now I'm not quoting the law directly, but I'm paraphrasing what it entails. It is illegal to commit or even have the intention to even intend terminating a pregnancy, and then whoever gives you advice or give you any substance with the intention of terminating a pregnancy is illegal. But then, under the same law, there are some exemptions. One of the exemptions is that incest. If a pregnancy occurs as a result of incest, and it means this person is falls under the exemption where termination can be done. Now, also, for whatever reason, there are certain pregnancies or certain conditions in pregnancies that are likely to threaten the life of the mother, where the mother could die as a result of the pregnancy. In that case, the person is entitled to abortion under the Ghana government or Ghana, the law, the PNDC law 102. Or if a mentally unstable person is impregnated, the person too gets an exemption. Then the final one is if the pregnancy is likely to cause any psychological or emotional trauma to whoever is pregnant, then the person can also seek termination, which is legal under the law. And so that is why under this particular statement, where the pregnancy is likely to cause psychological or emotional ill health, because if you look at the definition of health, it's not just merely the absence of disease or infirmity, but any other situations that could lead to you not being fine. And so under the Ghana government or under the law, the exemption was put in place. So that is why if somebody is pregnant and you believe that this pregnancy is likely to cause emotional or psychological trauma, then you go under that exemption. But now, beyond that, you have to seek safe abortion services. And remember, I spoke about HAC. So there are certain prerequisites that you need to satisfy in order to receive these safe abortion services. Okay. One, whoever is performing the termination should be trained. And in Ghana, midwives and then medical doctors, including obstetrician gynecologists, they are the people that are professionally mandated to perform this service. Now, apart from that, the professional should also be in a facility that is recognized and certified by what we call HIFRA, that's Health Facility Regulatory Authority. So all government facilities fall under this authority that will say that, okay, fine, this particular place is safe to give medical services. So me, I'm a midwife, professional, and of course, my PIN, there's something called PIN, professional identification number. I have one. So it means that under the law, I am a safe person to terminate the pregnancy. But then if I do it at my home, that becomes illegal. So be careful where you seek for your services. You should seek for your services at a place which is certified by a professional who is trained. And also, because it's not just any midwife, a midwife who is also trained. So all these things must be, or all these boxes should be ticked correct in order to fall and receive abortion.
Okay. So, MFA, you want to say something?
Now, I was adding up to Madam Rosina that the facility should also have the required tools or equipment needed for the abortion.
Oh, okay, okay. Thank you for that. And someone is, MFI is still asking that, how is the Ghana Health Service and other institutions ensuring that their staff offer these services without any prejudices? Because Ghanaians, we base everything on faith.
And on religion.
Yeah.
Great. So, I'll tell my father that you need to first of all go to the right place. So, for example, if you look at sexual reproductive health services, if you go to, let's say, a facility, and you look for where they give sexual reproductive health services, under that umbrella, that's where they do weigh-in. They not take care of pregnant women too there. So you see a lot of services under this area. So if you go there and then you talk to any of the midwives or any of the staff there, they will tell you that, they will direct you to the next place. And usually it is also for the sake of the people seeking the services that you don't see a place labeled abortion services. You won't see that. Because if it is labeled like that and you move towards there, everybody will already judge you. So that is why the service provision centers are there. But then somebody needs to direct you. So if you go to where they do in family planning services, you always see that you always get the facility that is also providing the services there. So yes, the centers are there. But then sometimes if you go and most young people, when they go, they're already intimidated and they're afraid. So they will just go walk about and move away. But you need to ask somebody. For your own protection, the service is not displayed. But then if you ask somebody, the person will direct you to the next place and then you'll be able to get your service. So the Ghana Health Service is making sure that the places are there. Health Facility Regulatory Authority is making sure that the place has the minimum standards and equipment. And then the midwives or whoever are giving these services go through trainings. And then they get surprise visits from supervisory authorities. So yes, I'll say that everything is being done to make sure that the service is provided. But then there are some of our colleagues who sometimes do not treat these people delicately the way they are supposed to be treated. But that is personal, and such, if anybody do that, then it means that the person is actually breaking the law. So we are, myself, my other colleagues, should be able to direct people that need services to the right places. Even if you can do it yourself, you need to direct them.
Okay. So, Madam May, someone is asking, Bernice is asking, are there reasons why someone cannot have an abortion, as in a health reason?
A health reason?
Why someone cannot have an abortion?
Why you wouldn't have? Everyone has the right to an abortion.
Okay.
But though it's illegal, but depending on the fact that, just like Madam Rosina said, if it's true, those she mentioned, you can have an abortion. But quite apart from that, I don't think you have any reason not to have an abortion. Unless, of course, the man, you are married, your husband wants the pregnancy, and maybe you had an issue with your husband, you want to terminate it. With this one, is outside the reasons why you should terminate a pregnancy. Or the pregnancy, everything went on well. You are not sick, nothing. It wasn't a rape, it wasn't an incest, and you want to terminate the pregnancy. You are capable, so why would you want to terminate the pregnancy? So with those ones, I don't think that abortion is really necessary.
Okay, you don't think, but then
yeah, but you will still try to counsel the person. If the person insists,
then okay. I wanted that to be clear, because I wanted to ask who like at the end of the day, who has the final say when it comes to wanting an abortion? The client?
Yes, it's the client.
Okay.
Yes, as Sister May said, there are times where couples really have problems. For example, I have a maternity facility, so there are times, let's say, a client has a baby of 3 months and is pregnant. Yes. And in this case, it becomes very dicey because this is concerning a couple. So we do couple counseling, and then we do focus counseling, which is meant for only the woman, and then we let them go back and then talk about it, and usually they'll come back with their decision. But if the woman walk in alone and demanding services, yes, after counseling, once she makes an informed choice, you have no choice but to do what the woman wants.
Okay. Yes. So if you have been watching us or you just joined us, this is the Young Voices Forum, and today we are discussing comprehensive abortion care. The discussion has been very insightful so far, and I like the contribution and the questions that are coming in. So if you just join us, you can also send in your questions so that together we would all learn. So Pretty J is asking, will abortion affect my chances of getting pregnant in future?
Okay.
You want to take that, May?
No, May will take that.
Okay. It depends on where you went for the abortion.
Okay.
Depend on the type of abortion you did. You know, we have safe and unsafe abortion. With the unsafe abortion, yes, it can. With the safe or comprehensive abortion care, the likelihood that it wouldn't is very great, because it's professionals who take you through it, and they will make sure that the abortion you are to do will be safe for you as well. So that I don't think it would affect. Madam Rosina.
Okay, Madam Rosina.
Yes, let me add something small concerning, if, as she said, if it is done right, then there is no reason why you cannot get pregnant in future. But then somebody also asked something concerning medical reason. No, medically there is no reason why somebody should be refused an abortion services. But remember what I said earlier on, as a midwife, you can only terminate up to 12 weeks. Beyond 12 weeks, I cannot help. So you may come to me, then I'll tell you that, okay, so let's do a scan. After the scan, then if it is beyond 12 weeks, by law, I have no right to take that pregnancy. But then I'll normally refer to somebody who can be able to help.
Okay, so I saw a comment earlier on, and I'm trying to find who gave that comment, but I can't. But I saw a question like, how long would it take for one to, you know, have sex again after an abortion?
That is interesting.
Yeah.
It is personal. It is personal. Now, when a pregnancy is terminated, it takes 2 weeks, approximately 2 weeks, to get fertile again. So, as the comprehensive package we're talking about, so it's not just terminating pregnancies. We go beyond counseling, then the termination, then post-termination, we look at family planning, making sure that you do not get pregnant, because 2 weeks approximately after termination, you can get pregnant again if you have an unprotected sexual intercourse. Okay. Yes, but then going back to sex after, it's personal. If you are no more bleeding and you are comfortable, why not?
Also,
yes.
Usually it's advised that you should wait after 2 weeks, then you have it because of the infection.
Yeah, because after a termination, where the product of conception was attached, there is a sore there which needs to heal. Yeah, but usually most people will bleed. The bleeding depends, or it changes from person to person. Some people may even bleed beyond 2 weeks after a termination.
Okay, so as we do it all the time, I'm giving out my first airtime. Like, the conversation has been so interesting that I've actually forgotten that I am your Santa before Christmas. So I'm giving out my first airtime, which is Vodafone. So fastest fingers, if you get it, do indicate it in the comment section for me. So the numbers are 85432459114179. The numbers, I repeat, 85432459114179, and that is Vodafone. So if you get it, do indicate it in the comment section for me. So if you, as I was saying, if you just joined us, it's the Young Voices Forum. We are discussing comprehensive abortion care. You can also leave your comments, your questions in the comment section. I have with me two amazing women do the discussion with me, and we'll try as much as possible to touch on all the questions you send in. And this program is brought to you in collaboration with the Ghana SRHR Alliance. It is an initiative of Savana Signatures, and it is supported by SGS, Simavi, and Gabby's Beauty Parlor. I saw one question here too. Oh, where has it gone to? Good. Pretty J is asking again, are there drugs given to the patients who might have aborted? Do they give drugs to someone that has maybe already, when you're done with abortion? I think maybe probably that's what she means. If you're done with abortion, are there drugs that are given to you again to, maybe solve something? I don't know what. But after abortion, I think after you've had a safe abortion, are you giving any drugs?
After abortion, usually they give some drugs because of infection. They can give antibiotics because post-abortion you may be infected, especially when it's the surgical procedure.
Okay.
There's a likelihood that you may be infected, so they do get those.
All right. So to add to that, usually it depends on the type. If it's the medication, you are not giving any, because she's not specific with type of drug. Yes. So we are just going through all the various things that can be done at that time. So if it is the medication, you are not giving any drug per se. It's just the medication that would help you to terminate your unplanned pregnancy. And then let's take it that post the termination, assuming you choose, let's say, the pill as a family planning method, then you are giving that. Okay. Now, when it comes to the surgical termination, that one, under normal circumstances, you are not giving anything. But then, if for somebody, it depends on the practitioner. Somebody may want to give you what called prophylactic antibiotic. It doesn't mean you have any infection, but it's just in case, because during the termination or after, you'll be having your menses. So if the personal hygiene is not good enough, it can cause or it can lead to an infection. So you may be giving that just to prevent you from getting an infection. And then let's say that provided somebody too was, let's say, anemic, the person HB or hemoglobin level was low, that is why it's called comprehensive, because before the termination is done, you are giving what we call a head-to-toe examination. So let's say during assessments, it is realized that the client is, let's say, pallor, which is an indication of low hemoglobin level. You may be given what we call a hematinic post, so that you will be able to replenish your hemoglobin level.
Okay. So I want to ask this. Are abortions painful? Is it painful to have an abortion?
Not.
Or the experiences differ for individuals?
Usually, sometimes the client is too tense because you are afraid and scared. And I must say, I'm not in the position to know this, but then most young people are so scared when they come. They are so afraid. So the pain may be coming from, it's a perceived pain. The person is, but then whoever is doing the procedure tends to try to put the client at ease and let the person relax. So for example, if it is the medication that you are taking through what to expect, when to report back if there's an issue. So there's several information that is given out there. But now, if you're taking the medication and then the pregnancy is about to terminate, you feel some pain. The pain comes in the form of uterine contractions, so they are painful. So part of the management, you are giving a painkiller. You are giving a painkiller to take, which will help minimize the pain. And then when it comes to the surgical termination, that one, they'll put there's something called a speculum, which is put into the vagina to be able to locate the cervix, which is the mouth of the womb. And now during that, it's uncomfortable but not painful. But as I earlier on said, it is, if the client is tense and is so scared, you may be feeling pain probably that doesn't exist. But I will say that there's some level of discomfort, but then we try to manage them to make sure that the client is fine.
Okay, so aside that, talking about managing to make sure the client is fine, do you somehow example, if someone opts for the surgical method, do you like, inject the person, so the person doesn't feel pain or something? Is it done? Because I've heard stories of them saying that when he opts for the surgical method, they do not, give you any pain meds or inject you, so that they want you to feel the pain so that next time you don't come and do it. I've heard stories like that. How true are these?
That is not right. Usually, mostly we have a protocol, and the protocol vary from place to place. So, for example, some facilities, before they even start the procedure, they'll give you some suppository. It's a medication you put in your anus, and then you wait for some. Oh no, it is not as bad. It's just like paracetamol suppository they give to babies for fever.
Okay.
Yes, so they will give it to you. You insert it in your anus. It's a painkiller, so it helps minimize the pain. Some facilities usually they give something called lidocaine. It's a local anesthetic agent. They normally is given at a particular point to help, because we use instruments. So to grab the cervix, you need to anesthetize where you are supposed to grab to make things easy. But then, as I said, most people will feel the pain when they are already too tense and scared.
Okay.
Yeah.
Okay. So someone is asking, Bernice is asking again, that is there any age limit for a woman to undergo an abortion?
From the beginning, we said that there's no typical abortion seeker. It could be me, it could be you, it could be her, it could be the gentleman sitting out there, the wife, There is no person. So we have young people needing the service.
Yeah.
We have middle age, and sometimes women in their 50s who may probably have thought they've gone into menopause before you realize an unplanned pregnancy happens. So any person who has an unplanned pregnancy should be able to seek abortion services. Yeah.
Okay, so Bella is asking again, saying, aside the pains you go through, how much bleeding is there?
With the bleeding, it depends on the individual. There are others that by the 7th day it will stop, and some will exceed.
Wait, you mean to tell me that people bleed for how many days after abortion? Let me answer that question first.
It depends on the individual. There are others that by the 7th day it will stop, and others will exceed 2 weeks. And it's missed miscarriage, it may even exceed to 3 weeks or almost 4 weeks.
Okay.
Yes, please.
Let me add more. Usually, if there is a pregnancy, it means that it was attached to a particular point in the womb. All right. So when a termination happens, and also depending on the method. So, for example, if you are using the medication, the bleeding comes heavy and in clots. Okay. And you are already forewarned that this will happen. And so after that, where the product of conception was attached to, it will go through healing. So you see that the bleeding will come reddish from the beginning, become pinkish, and then it will become whitish and then end. So by that time, the wound or the sore that was in the womb would have healed, and put it that way. So it can last up to 4 weeks for even some people. Okay. But once you know that this is what to expect, then you won't be worried about it. But if it is a surgical one, once everything is taken off, maybe after some 3 days or so, the bleeding is less. So the bleeding is less if you do a surgical. The bleeding is much less. So if you are bleeding so heavy after a surgical procedure, you will have to go back. You have to go back and seek for more medical attention.
Okay. So MFA is asking again that at some point, is multiple safe abortions dangerous? Let me ask this first. How many times can one get a safe abortion? Is there a limit to how many times you can get?
This is where I don't like answering this. It is very, very difficult sometimes to deal with human beings. It is okay. So let me go this way. Anytime you are pregnant and you want to terminate, yes, you should be able to seek for it. But professionally, it comes to a time you start wondering whether some people get addicted to it, because I saw a situation like that in Kikos about some 3 years back. There was a particular lady, every 4 weeks she's back. Every 4 weeks she comes back. And you see, it's comprehensive in the sense that there should be a family planning method attached to it. Now, she refuses the family planning service. She'll go and come back. So this is not somebody who is normal that we are dealing with. So it means that beyond terminations, she needs psychiatry or psychological help. So in that case, that was finally they had to bring in a clinical psychologist to really talk to her, because that is definitely not normal.
Yeah.
Good. But now, assuming you are terminating pregnancies, especially with the surgical method, every time you get pregnant, what happens is that the cervix closes very tight, and it's like a rubber band that is on it. Now, every time you have to do a surgical procedure, you need to dilate the cervix. We use, nowadays, we use very mild methods of dilating the cervix. When we say dilate the cervix, it means we need to put in something to force open the cervix. Now, when we do that, and you keep doing it several times, it's like a pant, when you buy a new pant with a band, you keep stretching it and keep stretching it, a time will come when it become loose, and that is where you get what we call habitual abortions. So now, you have done so many terminations, and then at the end of the day, that cervix, which is supposed to be, it should be strong enough to keep your pregnancies that you want. Now the cervix is now too loose. You get pregnant. When the baby starts getting heavier in the second trimester, then the cervix will open and spontaneously you lose the baby. So that is why we all make mistakes. As a young person, yes, you are entitled to one or two mistakes. But if you keep making mistakes, then it means that you yourself, there's something wrong with you. And so that is why under the umbrella of safe abortion service or comprehensive abortion services, you are taking through family planning, counseling, and service. Some facilities will even do the service, the family planning service for you first before even the termination.
Like should.
Okay. Someone is also asking, is the surgical procedure expensive, and can one get it on the National Health Service? I think when it comes to safe abortion, the question we just keep getting is, how much is it expensive, So is it expensive to get an abortion?
It's not.
Okay.
It's not expensive.
Okay.
But it also depends on where you are going. Well, not all the facilities take insurance. For instance, Aristos, for instance, it doesn't take insurance. But other hospitals, when you go, it's not that expensive.
To add to that, it's variable. So for example, if a private person has a clinic, the person will charge what you think, because a lot of things go into the surgical procedure. It's not just termination, but then beyond the termination, the instruments need to be kept safe and all those things. So it all depends. I know that the surgical procedure is the minimum you can get. I'm not so sure, but this is from about 200 and above. Because I've heard some places they take as much as 700, some places they take about as much as 1,000. So that's why I'm saying in the private sector, nobody determines the price. But then in the government sector, I don't know about how much it will cost. But I know in government facilities, it will be less as compared to a private facility.
Okay.
56 for MVA. Wow.
In the government facilities, so you can pay as low as 50 cedis in the government facilities. Okay. So our time is going, and then we have to wrap up soon. But I want to ask this: how beneficial is CAP to girls or women, people seeking abortion? How beneficial is it?
It's very beneficial, because with that one, you are rest assured that the person attending to you would make sure that at the end of the procedure, you, the client, you would be safe. Your next life or your next pregnancy, it would be safe. Psychologically, emotionally, and physically, you would also be safe.
Okay.
Because one attending to you is a specialist or a professional.
Okay.
To add to that, it is safe in the sense that yes, you'll be assured of what you want to achieve, because most of the time it is for the purpose of getting further education that a lot of young people or a lot of women want to terminate. Education tops. And so if you get safe abortion service or comprehensive abortion service, then it means that your aim of achieving your higher education is definitely assured. And then you get to determine your future. You get to determine when you are ready to get pregnant. But then the caution is that in the meantime, you cannot jeopardize your sexual reproductive health, because at the end of the day, you want to get pregnant sometime in the future. And so with comprehensive abortion services, you should be able to do that.
Okay.
Now, there is something that a lot of people, a lot of effects that a lot of young people do not know. I have had situations whereby young people have terminated pregnancies and psychologically they go, I don't know how to discuss it, I don't know how to describe it, like they go haywire. They'll come back saying that, I don't think it's gone, I think it's there. And some will tell you that, oh, I'm now getting certain discharges that was not there, and I believe it is the abortion that has. So some young people, especially young people, the elderly ones, you hardly get that with them. But psychologically, a lot of young people are not the same. Afterwards, every little thing that happens to them, if they even get diarrhea, they'll associate it with the termination. And that is what a lot of young people don't know. Psychologically, some people would have done that and feel that I have sinned, I have killed someone. And so, psychologically, to traumatize them unless they get somebody to talk to. So I am cautioning young people out there. It is all about being careful. When you think sex, you should think about protection before you even get pregnant. Don't even think that, oh, because we are saying that comprehensive abortion services is there, so do what you have to do and come back. Please, your life is in your own hands. So be careful with it.
Okay. So I was going to let you give your final words, but I'm not sure you can actually top what he just said. I think it sounds for final words, but I want to ask this last question before we wrap up. Someone is asking that as a young girl, do I need my parents' consent for an abortion?
With the age, if you are less than 18 years, I think your parents need to come in because you are under age. If you are more than 18 years,
so I'm less than 18 years. I am pregnant. I am scared. If you know my mother will kill me. You know, we cannot pretend that this is not the reality in a lot of homes. People. Not a lot of parents are so open for children to have discussions with them. So I am trying to get rid of this before it causes a rift between me and my parents. In that situation, what can be done?
And then with that one, if you go to a health professionals, they can do it. They know what to do. But as a mother, you should, especially even if the father is not the slow going type, but as a mother, there are certain things you shouldn't be so strict on your child with, because if your child can't discuss such a thing with you and goes ahead to discuss it with a different person, those are mostly the results of this thing, unsafe abortion. Or those are mostly the causes of unsafe or complicated abortion, because the child will go and do a different thing.
I like the submission, but African mothers have left the conversation.
Yes, let me add something to that. Usually, young people are in different age groups. So, for example, a child, let's say, less than 14, will need what called local parentis. You need to talk to somebody else, because you cannot just terminate like that. But somebody around 16, 17 going, at least they are older, and so you could terminate without consent. But then when the person is young, you need, not even if it is not the parent, but at least an adult who at least you'll be able to know that this person is a relative who can stand in for the person. And sometimes before you even terminate a pregnancy for such a young, very, very young person, you need to go and counsel the parents first, and then before you even come back to the child.
Okay, so we are wrapping up. Your final words, make it quick for me.
All right. So as we've been discussing this, they say when you are at the wrong side of the gun, it is when you really know what this is all about. Abortion is not a simple issue. It's a very complicated issue. But then the question is, if you think somebody else's child is a bad person, and so you've been able to do abortion for the person, yes, they will stigmatize the person, but then it could also be you. So we are not talking as a midwife. I'm not there preaching that, oh, everybody should get pregnant, come and we terminate the pregnancies, but we are there for people who genuinely need us, so that we terminate the pregnancy, so that the person will live long enough to even repent of the supposed thing that we are talking about. So there is no need to judge. Life is life. Sex will always continue to be there. Young people will always grow. They have the interest to have sex. And so these are some of the issues that are likely to happen to them. So I'll entreat parents that you should start talking to your young people about unprotected sex and about their sexual reproductive health in general.
Okay, maybe last words.
I think all I would say is, instead of abortion, you rather go for family planning. There are so many people who stigmatize family planning yet hail abortion. Mm-hmm. Just as Rosina said, the instant she gives us scapegoat, the person would be one of those who would saw someone who is practicing family planning. Mm-hmm. Those people would not want to practice family planning, but would want to go for abortion. So I would say we should rather hail family planning, and with that it will bring down the rate of abortion, and the stigma on family planning and abortion should be stopped so that everyone can access in this comprehensive abortion if the need arises.
Okay, so I'm very sure that we've all had the conversation, and I'm sure you've entertained or two, because I have. So I want to say a very big thank you to you, the viewer, for joining us today. Thank you for the comments, the questions, and the contributions. We are very grateful, and also a very big thank you to the technical team. I almost always forget, but without them, there will be no transmission, and you cannot get to see the beautiful discussions we just had. And then a very big thank you to SGS, Simavi, and also Gabby's Beauty Parlor for sponsoring the show. So until we come your way next week, same time, my name is Rahel Enchi, and I was your host for today. Bye.